All right, guys, welcome back to Underground Science. And in this video, we're going to be talking about carbon monoxide poisoning. All right, so let's go and get started. So, carbon monoxide gas, right? There's a few things we should know. First, carbon monoxide gas is colorless. Okay, it's colorless and odorless, and actually can bind hemoglobin 200 with 250 times greater affinity than oxygen. Okay, so that's something important that will come in handy to know later on in this video. Okay, so it can bind hemoglobin, or what we should say is it has a 250 times greater affinity than oxygen. Okay, so it binds to hemoglobin with 250 times greater affinity than oxygen. All right, so than oxygen. And another important thing is that when carbon monoxide binds to hemoglobin, we call that carboxyhemoglobin. Okay, because remember when oxygen binds to hemoglobin, we call that oxyhemoglobin. All right, so let's go and get started with the mechanism of toxicity. So when carbon monoxide binds to hemoglobin, it actually binds much tighter than oxygen would. So obviously, when carbon monoxide binds to the hemoglobin, right, it reduces oxygen delivery to tissues because it actually stabilizes the oxygen that's bound to the hemoglobin. So if we see here, let's get our cursor out. If we see here, carbon monoxide binds to hemoglobin in a much stronger affinity than oxygen would bind to hemoglobin. So what that leads to is something called functional anemia. Okay, so it leads to functional anemia, and so we'll explain what that is. So in functional anemia, what the reason for this is usually hemoglobin's bound to oxygen, right? So first, what we know is that blood goes through your lung vasculature, gets oxygen that's bound to hemoglobin, then goes to your tissues and delivers it, right? After the blood gets pumped out from your left side of the heart. But if carbon monoxide binds to your hemoglobin, what it does is it stabilizes this oxygen to hemoglobin um, bond. Okay. So that means that oxygen will not be able to be released into the tissues. Okay. So if oxygen's tightly bound to hemoglobin because carbon monoxide is stabilizing this bond between oxygen and hemoglobin, once oxygen goes to your tissues, or once blood is going to your tissues, right? Oxygen won't be able to leave hemoglobin and go to your tissues. That's why we call this functional anemia. Okay, because carbon monoxide stabilizes hemoglobin in the oxygen-bound state. Okay, so that obviously that can be dangerous because then if your tissues aren't getting oxygen, that can lead to a whole lot of negative outcomes. So let's read on and see what we say. So, well, first we should know how we get exposed to carbon monoxide, right, in the first place. Some common things that we should know, or some common ways to get exposed, is house fires, car exhausts, right? So especially in enclosed spaces, if you turn your car on and there's minimal ventilation in that area, carbon monoxide can definitely build up, and also faulty heating systems. All right. So let's talk about the main thing, which is the clinical features. So of course, if you're not delivering oxygen to your tissues, and one tissue being the brain, let's say, then of course you're going to have headache, right? If you're not delivering oxygen properly to your brain, that can lead to dizziness. If you're not delivering oxygen to your brain, that can obviously lead to confusion. Another really important organ that needs oxygen, right, is your heart. If carbon dioxide is bound to hemoglobin, right, the oxygen is not being properly released from the hemoglobin to your tissues, one of those tissues being your heart, then of course you're going to have chest pain or angina, right? Because of low oxygen delivery to your heart tissue or your myocardium. So that clinical feature, that symptom makes sense. Again, if you have low oxygen delivery, then your brainstem can detect that and do a compensatory response leading to increase in heart rate. So remember, if you have low oxygen and then your brainstem detects that, right? then that can lead to a sympathetic response, and that can lead to an increase in heart rate. So it's basically trying your body's trying to deliver more blood to your tissues by increasing your heart rate because it senses that you have low oxygen. So tachycardia makes sense, right? Again, we know that if you're not able to deliver oxygen to your brain, that can of course lead to seizures. Again, if you can't deliver oxygen to your brain, that can lead to syncope, right? Or fainting. And also, again, if we come back to the heart, right? If you don't deliver oxygen properly to your heart, you may be able to create reentrant circuits, and that can lead to, of course, that can lead to a heart attack, but that can also lead to arrhythmias, okay, or irregular heart rhythms. All right, so hopefully those clinical features or symptoms make sense. But a really important symptom, right, a clinical feature we should be aware of is cherry red appearance of the skin. Okay, so that's a familiar phrase that we should be aware of for carbon monoxide poisoning. Okay, cherry red appearance of the skin and headache early on. Okay, so if we look at more about this, right, carbon monoxide poisoning. So what we said was carbon monoxide poisoning leads to low oxygen delivery to your tissues. And as we know, if you don't deliver oxygen to your tissues, instead of doing aerobic respiration, your tissues will switch to anaerobic respiration. Okay, and we know that anaerobic respiration leads to increase in lactic acid. Okay, so that's the answer to this is of course your lactic acid levels may start to rise. All right, and that's not good because the more lactic acid that builds up in your blood, and that will lead to metabolic acidosis. Okay, another thing that we should be aware of is the SaO2 and the PaO2. Okay, so the partial pressure of oxygen in your blood may actually be decreased. And why is that? Because if you're not delivering oxygen to your tissues, let's say one of those tissues is your brain, of course, right? And your brain stem. So we know your brain stem is important for respiration, right? So if you're not delivering oxygen to your brain stem, that may lead to CNS depression. Okay. And if you have CNS depression, then your brainstem, right? If your brainstem's not sending proper signals for you to breathe, inhale and exhale properly, then of course that's going to lead to hypoventilation, right? So you're not breathing properly, you're not taking enough air in, and you're not breathing enough CO2 out. So if you're not taking enough air in, you're not taking enough oxygen in, which will lead to a low partial pressure of oxygen in your blood. Okay, so that's a way that it can be decreased. Obviously, another way that your PaO2 can be decreased or your partial pressure of oxygen in your blood is if you got carbon monoxide poisoning from a house fire, right? So if something's combusting or burning, we know that's consuming oxygen. So that directly leads to a decreased partial pressure in oxygen, right? Because if you have less oxygen due to a house fire, which is consuming oxygen, less oxygen will reach your lungs, so less oxygen in lungs, and then that means that obviously less oxygen will be in your blood. Okay. And then of course, if you're inhaling all that smoke, again, the example is a house fire, that could increase a lot of or increase inflammation in your lungs and lung injury, right? Which can definitely lead to edema, and that can decrease the amount of oxygen that actually makes it from your lungs to your blood. Okay. So that's obviously another reason that your PaO2 can be decreased. Now, your SaO2, right, could be normal or falsely elevated. So if we talk about pulse oximetry, right, in the pulse oximetry measurements, the percent of oxygen bound to hemoglobin, right, that's what the pulse oximetry is measuring, it could be high. And the reason why it's high is because the pulse oximetry measurement, right, when you use the pulse oximeter to measure the percent of oxygen bound to hemoglobin, what actually happens is the pulse oximetry or the pulse oximeter cannot tell the difference between your carboxyhemoglobin and oxyhemoglobin. Again, remember, we said carboxyhemoglobin is the hemoglobin bound to carbon monoxide, and the oxyhemoglobin is the hemoglobin bound to oxygen. So remember we said that when carbon monoxide binds to hemoglobin, it actually stabilizes this oxygen to hemoglobin bond, leading to functional anemia because then the oxygen cannot be released from the hemoglobin and go to your tissues. Okay, so that's why the pulse oximetry reading can be falsely elevated. Okay, but it's not actually you don't actually have a lot of oxygen bound to your hemoglobin leading to a lot of oxygen in your tissues. You're actually decreasing the oxygen delivery to your tissues. That's why we say it's falsely elevated. Okay, so that's actually really important to keep in mind when we're dealing with carbon monoxide poisoning. So we already talked about carbon monoxide poisoning in terms of how it affects your hemoglobin and overall oxygen delivery to tissues, right? So we know that when carbon monoxide binds to hemoglobin, what it does is it stabilizes the oxyhemoglobin form, which means that oxygen it cannot leave the hemoglobin and go to your tissues, leading to functional anemia, right? Low oxygen delivery to tissues, which we also said can increase your lactic acid levels, leading to metabolic acidosis. But another thing that carbon monoxide actually does is it binds to your cytochrome C oxidase enzyme, which, if we're familiar with our electron transport chain videos, that's complex 4, right? So that's the last complex before, oxygen receives electrons, gets reduced, and then we have water formation, right? The formation of H2O and ATP. So if carbon monoxide binds to complex 4, then that means ATP production decreases, right? You can't produce ATP then because you can't properly reduce oxygen. And then obviously you can't produce ATP afterwards because we know that the hydrogen protons flow inside into the mitochondria as we produce the ATP, right? And of course, as we know, if you if complex 4 isn't working properly, right, that means aerobic respiration won't work properly, which means what? That'll eventually to anaerobic respiration, which will increase your lactic acid levels, which can lead to metabolic acidosis. All right, so that's the main mechanism of carbon monoxide and how it affects the electron transport chain, leading to the disruption of aerobic metabolism. Okay. So last but not least, we can go into the treatment, which of course we would obviously try to give as much oxygen as possible. So that would be 100% O2 via non-rebreather, right? And then of course, if you want the best possible treatment along with the oxygen therapy, we can do that through instead of just normal oxygen therapy, you do it through a hyperbaric oxygen therapy, meaning an increased pressure. So what I mean by this is, so basically hyperbaric oxygen therapy is oxygen therapy, but under high pressure. Okay. So for example, if you're giving 100% oxygen, you'd actually deliver that under high pressure. Okay. So maybe like 2 atmospheres. And what that does is it actually forces or increases the dissolved oxygen in your plasma, which of course is good because then that means more oxygen can go to your tissues. Because that's not happening. That's what's not happening in carbon monoxide poisoning. Okay, so that can even reduce the carbon monoxide half-life, which is also a good thing in carbon monoxide poisoning. All right. So yeah, that's basically it. Those are the main treatments. These are the main high yield things to know for carbon monoxide poisoning. I hope this helped a little bit, and I hope to see you guys in my next video.